our Congressman from the 8th District, Dr. Steve Kagen. Thank you.
Flu is a significant risk to hundreds of thousands of United States citizens, and it will only be by a cooperative effort of our federal government and our healthcare facilities across the country that we can develop a vaccine that will be safe for humans and will prevent this contagion. So I want to thank you for what you're doing and thank you for coming out to have this conversation. I believe it will be a constructive conversation about the direction we're going to be going in regarding our healthcare system. I don't think anyone in this room wants to pay more for their healthcare. I would say that everybody across the nation would agree that we're paying far too much already. Indeed, in my personal view, as a practicing physician for over 30 years, I believe we're spending enough money now to cover and guarantee access to health care for every citizen and for every legal resident. We're already spending enough. So we have to focus first on putting patients first and at finding and eliminating all the wastes in the current system. And there's a lot of it that we can talk about. So I'm focusing on my patients, and as a member of Congress, as your voice in the big house in Washington, just as I did when I was a medical practitioner. It's all about patients being first. Now, I'm going to open up any question you may have. If you just come down forward, tell us who you are, and we'll handle any and all questions you may have, and I'll be happy to respond to any questions you may wish. Come on forward. It's a Green Bay Packers shirt. We won't talk about Brett Favre today.
I would like to know about this abortion issue, and one of them said, one of them that is in there explicitly says no public funds will be used to finance the procedure. I would like to know if that got through the committee level, because I've heard there's absolutely not one word in this bill about abortion. And if we do not have anything in there about abortion, there will be abortion, will be covered, and there will be no Catholic hospitals anymore. And that's just what my priest told me.
Okay, well, thank you very much for the question. It is a misconception because there's nothing in the 850-page bill and nothing in the 1,017-page bill, nor will it be anything in the final bill that would cover that medical procedure.
If there's nothing that explicitly takes it out of there, it will be covered.
Thank you for your question.
Will these 10 million illegal aliens be covered by this insurance?
Well, thank you for your question. The answer is absolutely not. There is no federal legislation. There is no federal legislation that provides any federal services or your tax dollars to people here who are here outside of the law. So there will be no services provided in the final bill going through the House that will cover people here outside the law.
What happens now when these illegals come over and they have their children here, and we have to support them, like in California, the state's spending how many billions of dollars on all these illegals, and they're getting all this stuff for mix.
Well, they're getting service now, and you're paying for it. So the goal is to drive down the cost for everybody by creating larger risk pools to guarantee our care goes down, and making certain that we also pass laws like the SAVE Act. Are you familiar with the SAVE Act? The SAVE Act is a bill that is sponsored, I'm a co-sponsor of, that would allow employers to immediately check on the Homeland Security computer using the Social Security card number provided by the potential employee to determine if they're here legally and available for hire. That's a bill that I'm supportive of and one I'd like to see passed to help to make certain that people who come here to this country, they're coming here not to get health care, they're coming here to work because they're hungry. And so if they're coming here to work, we should make sure that they're here legally. Wouldn't you agree? I'll remind you that in our district, in northeast Wisconsin, the greatest cause of bankruptcy is the high cost for health care. It's causing people to lose their homes. These are the numbers. The most common cause for bankruptcy today is the high cost for health care. Yes, sir.